Welcome, doctors. What was supposed to be a simple administrative step has turned into one of the most frustrating, time-consuming, and emotionally draining parts of healthcare today. One medication authorization specialist described it perfectly when she said, "It was supposed to be an easy position that needed help, but it has become extremely frustrating and defeating." Across clinics everywhere, prior authorization teams are buried under endless paperwork, unclear payer rules, and unrealistic expectations from both providers and patients. Every day, providers prescribe high-cost medications that require extensive documentation and medical justification. When even one small detail is missing, like a lab result, a diagnosis code, or a note, the entire process stops. One coordinator shared, "We handle all prior authorizations for 9 providers, and we are constantly behind. Many prescriptions are denied because they don't meet payer requirements, and some providers expect us to." This ongoing struggle is leading to burnout, frustration, and a growing sense that the system is broken. When your staff feels like they're always behind and your patients are waiting weeks for medications, everyone loses trust in the process. The truth is, medication prior authorizations have become a workflow nightmare. Providers send orders without verifying coverage, and the PA team spends hours fixing incomplete or incorrect documentation. One specialist said, "We spend hours trying to fix incomplete orders. Sometimes it takes 20 minutes just to find the right diagnosis in the chart." And if your clinic handles Medicaid, you already know how difficult it can be. Denials for elective or weight loss medications are almost guaranteed unless every requirement is met. So the PA team ends up stuck in an endless loop of denials, appeals, and more denials. While patients keep too often, it's the staff taking the blame for situations that could have been avoided with better documentation, and coverage policies vary from payer to payer, and they change constantly. As one billing specialist explained, the vast majority of insurance plans do not cover weight loss medications. No amount of prior authorizations or appeals is going to change that. They assume if their doctor prescribed it, it should be approved. The patient blames the clinic, the provider blames the PA team, and the staff is left trying to manage confusion that it's not just a payer issue. It's a workflow and communication issue. Providers need to verify coverage and understand documentation requirements before sending prescriptions to the PA team. Some clinics are addressing this by using internal checklists and approval pathways to ensure all documents, lab results, and diagnostic codes are ready before submission. This small change dramatically reduces denials and rework, but technology is also starting to make a real difference. iTools can now automate much of the repetitive work: filling forms, checking payer rules, verifying benefits, and tracking submissions. These systems save hours every week. However, AI alone is not the full answer. As one manager put it, AI tools can process data, but human specialists still need to manage documentation and interpret payer feedback. That's why the best solution is a combination of AI and human expertise. Virtual prior authorization specialists trained in payer rules, clinical workflows, and medical terminology can manage these tasks from start to finish. They ensure the process runs smoothly by reviewing documentation, catching errors early, and maintaining communication with payers. This hybrid approach reduces backlogs, avoids denials, and frees up staff to focus on patient care. At Staffingly, our teams specialize in exactly this. Our virtual prior authorization specialists handle complex medication workflows for healthcare organizations of all sizes. They combine automation, clinical understanding, and administrative precision to deliver faster approvals, fewer denials, and less burnout. Every engagement is HIPAA compliant and managed securely, giving you peace of mind while improving efficiency. When your team isn't buried under endless paperwork, your clinic can finally breathe again. If your staff feels overwhelmed, your patients are waiting too long, and your practice is stuck in a cycle of repetitive AI, and virtual specialists can help you cut through the chaos, streamline the process, and get back to what truly matters: helping patients, not fighting paperwork.